Wanted to welcome everybody to the Women's Health Finalist Spotlight for the 7th Annual Digital Health Awards. We're really excited that everyone is here. I am honored to be joined by Dr. Daniel Kraft. He's one of our executive producers and a longtime innovator in the digital health space, and Alice Zheng, a trailblazing investor and champion for women's health innovation. Today, you'll hear directly from some of the standout finalists in this category. They are companies that are shaping the future of healthcare for women across the globe. And with that, I will hand it off to Jason.
How you doing, everyone? I'm Jason. I'm the head of insights at CB Insights. We're partnering with the Digital Health Awards and with Health, the conference as the predictive intelligence provider, really helping everyone understand better sort of who the players are, what they're working on, and what's going on in across the digital health space. Today, specifically focus on sort of the women's health market, the femtech market, and what you guys are all here to talk about and present your awesome solutions for. Predictive intelligence on private companies. It's what we do, and we're here to, we'll have our app integrated directly into the health show, have this available so that everyone can understand sort of who they've met with, who they want to meet with, and the best ways to go about navigating the conference chaos before, during, and after. When looking specifically at the latest trends on the women's health market, I'm going to tell everyone to immediately ignore the left-hand most column for 2021 because everything looks like that in 2021 and then in the years since. Right, we look at sort of this interesting paradox right now with the market projected to grow about 25 million in the next, 18 million by 2030, but a 75% decrease from the 2021 peak, or even levels of funding below the last 3 years that aren't really on pace to see the same level of deployment of capital by the time we get to the year end this year. Right, we're seeing that only 3% of digital health funding right now is going to femtech, despite a growing TAM and sort of anecdotally from a lot of the investors, right? I spent a lot of time talking to investors, a lot of interest in the space. So I think there's a lot of pent up capital, a lot of recognition of the opportunity, especially with what's coming out in terms of, or what's becoming possible in terms of personalization, AI, and sort of the regulatory barriers falling for the applications of AI in women's health or in health more broadly, for a new wave of funding that seems very optimistic for 2026, looking at where it will all go. If we look at the sort of the markets where we see the most maturity, especially commercial maturity in terms of where companies are already seeing a lot of traction, right? We see that the D2C prescription services, fertility financing, and connected, some of the existing sort of wearables or hardware options are seeing a lot of more mature markets, more usage, right, and try to come up with a consistent word across all of those. Right, and we see a lot of more opportunity in virtual maternity and menopause care, and then sort of this new wave of AI-powered software and apps. When we look at some of the most interesting market opportunities, we see that some of the taking the femtech approach to a lot of the standard digital health areas, right? Heart disease, autoimmune disorders, and then sort of global expansion of care are all something that we are seeing as big opportunities. And then there are unfortunately still some headwinds that we see across both funding currently and sort of this market opportunity mismatch. And with that, hopefully didn't set too depressing of a stage for all of the opportunities that you guys have to now go and build the future of women's health.
Great. Thank you so much. And thrilled to be here with everyone. My name is Alice. I'm a physician turned management consultant turned investor at a fund that specializes exclusively in women's health. We are called Foreground Capital. We have 24 portfolio companies under an RH Capital umbrella and are currently starting to deploy out of our Fund 3 under Foreground. So we are big believers in the space, and the talk that we just heard hopefully is convincing for the audience as well. So what is women's health? This is a $1 trillion opportunity as highlighted by McKinsey and the World Economic Forum that affects women exclusively, such as reproductive health, differently, such as heart health, and disproportionately, such as autoimmune. So women's health is really quite broad, and we're really excited to have a stellar group of companies presenting today, presenting as in discussing what they're working on. And yeah, happy to answer any questions as well about the space if anyone's interested on market research on our fund or anything else. Please connect with me on LinkedIn.
Thanks, Alice. All right, let's jump into it. I don't know if David, you have the overview slide for the Digital Health Hub Awards. Essentially, this is, I think, the 7th year. I've been one of the co-executive producers, and Daniel Kraft, I'm a physician scientist, founder of Digital.Health and NextMed Health. And Digital.Health is a platform with now over 5,000 plus growing solutions, including many in women's health, where you can learn, share, and care and leverage these technologies going forward. So I think most of you are familiar with the Digital Health Awards. We've had over, I think, 1,500 companies apply this year in several categories. We went through the semifinalists and down to the finalists, which we're going to hear from today in the women's health category. And we're asking each of the stellar company founders and representatives to share a bit about their company, why they're doing it, what their problem they're solving for. And then Alice and I will ask hopefully some smart follow-up questions. And hopefully we'll have time at the end for a bit of an integrated discussion looking at the breadth and scape of women's health and what's needed going forward to continue to catalyze it to make impact. So with that, we're going to hear from the different companies in the space. We have both what we call the rising stars and best in class. So rising star finalists are those who are younger companies, sometimes very early, sometimes the most exciting ones on the planet, and then best in class are a bit more established. So we're starting with our, I believe our order is starting with Teal.Health.
So Kara Egan is our CEO and co-founder. She just happens to be traveling, as well as Mallory. And so, yes, I'm Lisa Santos, head of product marketing for Teal.Health. Very happy to be here. On the day of It Health, Kara Egan will be there. But as Daniel mentioned, we're Teal.Health. We have designed the first and only FDA authorized self-collection device for at-home cervical cancer screening. We received FDA authorization in May of earlier this year. And we are additionally a telehealth platform, women's health telehealth platform. So we have a medical practice on the side. So every time a woman seeks out to have an at-home screening, and this is an alternative for an in-person pap smear, it is a primary HPV screening. She will meet with one of our providers virtually for a quick visit and kind of be coached, discuss her history of screening and be coached through kind of the at-home screening process. It's a big shift in the market. A lot of women are eager for it. Cervical cancer screening rates have been on the decline for 10 plus years. Nearly 1 in 3 women are underscreened today. And I think a lot of women who experience this exam understand the discomfort with just the physical intimacy of the exam, as well as it's just tricky to get in office to get screened. And so it's an easy cancer screening that gets kind of pushed to the side or delayed. And it is a cancer that can be eliminated if everyone were screening and vaccinations, which we know is a whole other conversation. But together, we could collectively work towards eliminating cervical cancer, and that's a large mission of ours, is to get more women screened, make it comfortable. We've designed the wand, actually, not that I planned this, but I happen to always kind of have one by me. It was designed together with women's voices and experiences. And so it is certainly designed for comfort. And so far we've been in market since FDA authorization in May. The company has been around for several years. This is new, but obviously it's a large undertaking. And so we've been servicing women for 3 months now, officially in market, and we're expanding kind of state by state. And that's Digital.Health. I hope kind of answered all the questions.
Fantastic. I'll ask a quick follow-up. Maybe Alice has one. I mean, this is like sea change. This is a major change to do home-based pap smears, which has a huge public health implication as well. What percentage of women, at least in the United States, are not getting their normal pap smear? And what one big lesson have you learned in changing this whole dynamic, which is a major shift in how women's health will be practiced?
Yeah, the numbers are kind of all over the board, right? Kind of more generic publications would say 1 in 4, but it's actually kind of in between the 1 in 3 and 1 in 4 women in the US are not up to date. And the screening age, depending on the test, is 21 to 65 for HPV screening, 25 to 65. And so when you think about those ages, right, like that's 40 years of a woman's life when you're most busy. I mean, you're right, like, family planning, career building, it's just kind of the most difficult years to find the time. And a lot of the time women are prioritizing, their family's health over themselves. And so again, it's a very important preventive screening, but as we all know, it does get pushed to the side. And so outside of just making it more accessible and convenient, it's also a much more comfortable experience. So many women have experienced trauma, whether sexual or birth trauma. And so it's, we're just finding, actually the response after people have screened has been very emotional. And so I think it's kind of on a day-to-day, the team is, you always feel good about, I guess, kind of what we're doing. It is as you had said, it is a large shift. And so there's a large educational component here, because not only is it taking a screening that, the speculum is difficult when you tell someone you can now do this at home. A woman is like, I don't understand what that means, because how would I ever insert something like that? And so it's overcoming the experience as well as just the change in test, the industry, moving towards the primary HPV screening as the leading guideline, leading test in the guidelines. So large educational component, but very rewarding, because I think several countries are already doing this. So the US we're not the first, we're just kind of catching up, but there's a lot of change we can make here.
Great. Thanks so much. Very exciting. We need to move on to our second company, May Health, and we'll over to Maya Hardiman.
Hi, such a pleasure to be with all of you and in your company today. I just scrambled to pull up a quick slide. So if you don't mind, I'll bring that up. May is a digital first services company that is really focused on bridging access gaps in maternal health with a specific emphasis on working with Medicaid insurance plans across the country and working with our most socioeconomically disadvantaged mothers and those with the most striking disparities in maternal health outcomes. And so we're doing that in a few ways as a company. One is that we focus very heavily on earlier and more continuous identification of risk factors. We think about these very broadly. It's physical risk factors, it's mental health concerns. It's also, very importantly, social structural barriers to care that are really getting in the way of one being able to meaningfully engage in her own healthcare and in maternal care and in the consistent way that is necessary to drive forward more positive outcomes. Number 2, and central to our solution model, is the work that we're doing to activate, for insurance participation, community-based doulas. So we are in each of our states where we're working with Medicaid insurance plans, working to find local doulas who live in the communities that they're serving, working to onboard them as state Medicaid providers, onboard them with our insurance plans, really with the goal of bringing services and support and education into the homes of the mothers we serve. Right? And the doulas really serve as advocates and champions and educators and partners in care, though they are not conducting maternal health care themselves. And lastly, we focus very meaningfully on virtual group-based education. This really focuses on topics of critical importance to our mothers that are not addressed or met in their core obstetrics care, right? And so things really spanning healthy nutrition, exercise, self-advocacy, birth planning, all of these sorts of things. We have put in place a model where we have different types of maternal health educators that are coming together for our community and really focused on supplemental education that we know can drive meaningful outcomes. All of which is to say, we've been doing a lot to more meaningfully engage this population. driving engagement, driving education, driving doula participation in care, and more frequent maternal health touchpoints in communities in their own homes. We have over 70% of our population, our enrolled population, that's engaged doulas in their care. We have nearly 70% of our enrolled population that have indicated a care flag. And again, these are things that our insurance partners may have not otherwise been aware of from a care gap perspective or a SDOH perspective for our moms. And we're working very closely with our plan partners to address those needs on an ongoing basis in the interest of care gap closure and more consistent engagement in care. From a clinical outcomes perspective, across our now 11 states and 18 health plans, we have had an over 26% reduction in C-sections for our enrolled population versus plan baseline data, and an over 41% average reduction in preterm birth rates against plan baseline data. And so I say this all the time. We're very proud of these outcomes, but we're also not surprised by these outcomes because in many cases we know that these interventions work, and we've known for generations what we need to be doing differently in the maternal health space, right? And so our challenge and our opportunity now is to put more of those clinically established interventions, including doula participation in care, on path to reimbursement and in the hands of the moms who need that support. All right.
Great. Thank you so much, Maya. I know I'm a little biased since we're investors, so I'm very proud of everything you accomplished and congratulations. And maybe just for one, since keeping time, maybe one question for you would be, what is your biggest lesson learned from delivering all this great care to women, across several states and in forums?
Yeah, I'll try to keep this brief. This is something that really weighs heavily on me, is how wrong sometimes the central narrative we hear about Medicaid beneficiaries and generally socioeconomically disadvantaged peoples are when we think about their willingness to engage in their own care, right? I think when I was founding May, I heard a lot of folks saying to me, just because you build it, they won't come. Just because you build it, you won't be able to engage. And that was so deeply wrong, and I think offensive, right, to suggest that individuals who are having babies don't care about their health outcomes or the health outcomes of the babies that they're bringing into the world. They very much care. We built it and they came. And I think reorienting this narrative, right, and really just being adamant in our messaging to say, you offer the resources people need, and the people will take advantage of those resources and do everything that they can to engage in their care in the most meaningful way, I think has been a really important narrative shift for us to tell, and one that we've been really bullish on telling in our own BD exercise.
Great. Wonderful. Thank you.
Yeah, very welcome.
All right.
And congratulations to everyone.
Yeah, fantastic solution. Thanks. Over to Sarthak from Sama Fertility.
Hey, thank you so much for having me and building on what Maya just said. Access to IVF is the problem that we are solving at Sama Fertility. Access gets thrown around quite liberally at conferences, and then when you start looking at it, you start seeing that the stats actually do support that. Only 1 out of every 25 people that need care or need IVF treatments actually end up getting IVF treatments. And that is the exact problem. So if you take away anything about Sama Fertility, if there's one thing that I want you to take away, it is the fact that Sama Fertility delivers IVF to patients, treatments to patients wherever they are. That's literally it. And in the next 5 years, if I wanted something to change, it would be for us to go the pulmonology way. What I mean by that is that most sleep studies now are done completely remotely, and that's exactly how I imagine fertility to look like 3 years down from now. And 5 years, it should just be the norm. There should not be a patient that is bouncing back and forth like a ping pong ball between their home and their IVF clinic, which more than oftentimes is more than 2 hours away. And that is the problem that we've solved. We've been around now for about 3 years. We have many, many little babies that we can show our success rates with. In terms of more serious reporting, we actually outpace national averages in terms of outcomes. So you are more likely to have a fetal heartbeat when you go through treatment with Sama. And we can attribute that to many things. I'm a scientist, so I don't generally tend to use stats without backing it up, and we don't have a formal study to understand why that's the case. But what I will say is that virtual care, which is delivered to the patient, which the patient takes autonomy over, works just as well for the patient in the realm of IVF. So what was science fiction once is something that now we want to deliver to everybody at their home.
Fantastic. Just help us understand real quick what you're sort of trying to do all of IVF virtually. How does your virtual and your physical interact, and what
Thank
is it?
you. Yeah, I imagine that to be the follow-up question. I just want to keep the first one brief. IVF can be divided into two parts. One, which is the obvious one that Daniel pointed out, which is the in-office, you have a surgery, you retrieve, etc. We haven't figured out how to do that at home yet. But what we have figured out is everything that leads up to it. So right from diagnosing the patient, testing them for qualification around treatment, making sure they have their medication. And then what is important is the monitoring, which takes up almost 80% of the time. We, in fact, at Sama are able to deliver a handle ultrasound. I don't have one at hand right now because every single one of ours is deployed right now. That ultrasound just goes out to the patient. They self-administer it under the guidance of our ultrasound technician. And then what makes the magic work is a really, really insane software that make sure that none of the balls are dropped in this otherwise pretty complicated treatment. So on the front end, the patient interacts with us through, a machine of sorts, an app. And on the back end, the clinical team is able to take care of the patient wherever they are.
Fantastic. Making babies in your sleep. All right. Awesome. Over to Priyanka from Evie.
Amazing. Thank you so much for having me. Evie is building a consumer-first platform focused on closing the gaps in data and research. I mean, we heard some of this earlier today, that we didn't study women in the US until 1993, that to this day, women are diagnosed on average 4 years later than men across over 700 of the same diseases. And we at Evie are really curious about what we call kind of under-leveraged or underutilized female biomarkers that could help us predict risk and improve outcomes in female-specific bodies, so that we can finally unlock what Dr. Kraft has been talking about for, I think, 15 years around true precision medicine, which obviously you can't have if you don't have any data on half the population. We're specifically focused on leveraging the vaginal microbiome, and there's really two reasons for that. One is that vaginal discomfort is the leading reason women seek healthcare advice in America, and we are more likely to be misdiagnosed and not get better than we are for the opposite of either of those two things to happen, which is insane. And two, that having pathogenic bacteria in your vagina and a generally disrupted vaginal microbiome then also radically affects outcomes across our lives. You have an infected and inflamed reproductive tract, which then affects outcomes across IVF, fertility, preterm birth, cervical cancer progression, STI acquisition. I see a lot of partnerships on this phone call potentially. And we just can't believe that nobody is using any of this data to predict and improve outcomes across the female lifespan. So we've built the first and only comprehensive vaginal microbiome test and precision care platform. For the first time, patients and doctors can get answers to everything going on in the vaginal microbiome with a single swab. And then we're able to much more precisely stratify disease, enable data-driven predictive diagnosis, and unlock truly personalized treatment. So custom compounded suppositories made with exactly what patients need and sent to their door. We now have peer-reviewed publications showing that our test is more accurate and comprehensive than anything that exists for doctors and patients. And exciting new paper on our care platform, which is the largest study of at-home vaginal health care ever done, showing that we radically improve outcomes compared to the standard of care. We now work with over 75,000 patients across the country, over 2,000 medical providers, and we primarily support patients dealing with vaginal symptoms in reproductive age and in menopause, and patients who are trying to conceive. And we actually are right now working with the largest network of fertility clinics in the country to prove that we can actually use our platform to predict and improve IVF outcomes, which we are very excited about. And lastly, we now have built the world's largest data set ever on the vaginal microbiome by miles. We've actually discovered double the number of genomes than had ever been documented on the vagina before Evie. And we're now using that data to hopefully improve outcomes across the female lifespan.
Great, thank you so much. And Daniel and I will ping pong on questions and how funny, also a company we're very proud to invest in. So congratulations on everything you've achieved and to all the finalists. So the question for you is, you're doing some really interesting, kind of groundbreaking work on understanding, female biology more. And my question is, what tailwinds in the past several years, whether it's market, regulatory, scientific, any of those, have enabled you and Evie to achieve what it's achieved?
Such a good question. I would point to two specifically. I think one, I think there's a lot more interest, and again, this is something Dr. Kraft has been saying for 15 years, in data-driven kind of biomarker-first healthcare. So instead of what I would call in women's health kind of storytelling diagnoses everywhere we look, can we get to a true biological molecular reason that a woman is experiencing symptoms or disease? And I think that the interest in data testing driven healthcare exists more broadly now. And I think that women's health is kind of probably the last to follow on to that. So I think we are benefiting from that. And the second is an obvious one, which is the consumerization of healthcare. I think that women's health specifically benefits from this because, frankly, nobody in the system is incentivized to change except for the patients themselves. I think many of us here are probably frustrated patients who believed that there was a better way for the system to operate. And I think as more consumers have control over their health, the more solutions like the ones on this call will propel forward.
Fantastic. Another amazing company in the space is Day, and we're going to hear from Valentina.
Thank you so much. And to Priyanka's point, another frustrated patient turned founder over here. Thank you so much for the opportunity to present our work today. At Day, what we're building is a set of comprehensive medical and diagnostic devices which are utilized for some of the most common yet most underserved gynecological health conditions. And I will just quickly share my screen, but it doesn't seem I have permission, right? So anyway, what we do is we create new medical devices, new diagnostic devices, such as the diagnostic tampon, our hormone testing service, which are designed to very conveniently, in a pain-free manner, enable the patient to have access to their comprehensive vaginal, menstrual, and hormonal health data, all from the comfort of their home. So we're big believers in enabling the patient and the clinician to have access to the full picture in gynecological health. At the moment, one of the central issues that we have identified is that we treat women's health in isolation, despite the fact that we know that when you treat vaginal health, you end up affecting menstrual health. When you treat menstrual health, you end up affecting hormonal health. So what we aim to be is a comprehensive partner to both doctors and patients throughout the entire life cycle of a female patient, from their first menstruation through to menopause and beyond. And I started this company, I started my research on it in 2017, really inspired by my own personal gynecological health horror stories, and then gradually through conversations with my peers and my friends, realizing that I wasn't a one-off case, I wasn't just someone with bad luck, but the reflection of systemic wide issues. At the moment, our solutions are available on the US market. We're backed by established CPT codes. We're eligible for FSA, HSA reimbursement with the diagnostic tampon for gynecological health screening at home, the hormone testing for comprehensive female health reproductive testing. And alongside the physical, medical, and diagnostic devices that we manufacture and commercialize, we provide comprehensive complementary digital health services such as nurse consultations, OB consultations, prescription treatments, in order to never leave the patient stranded with a set of confusing or potentially troubling results, but to really enable them to take the next step. So diagnosis being 1, aftercare and ongoing treatment being 2 and 3.
Fantastic. Valentina, what have you learned about women adapting, a diagnostic tampon? And then how do you think about OB-GYNs, primary care docs using the insights and data from your solution?
Yeah. So one of our central hypotheses at Day has always been to tap into an existing patient behavior and make that existing behavior more valuable for the patient. So currently in the US, about 90% of people use tampons on a regular basis. But tampons don't add as much value to our gynecological health experience as they could. And we built on top of existing research from the 1980s. It was actually the former Commissioner General of the FDA, fun fact for you, that did one of the first clinical trials on using tampons to diagnose STIs and HPV. And we've had this information since the 1980s that tampons are a reliable self-collection tool for vaginal infections, for STIs, for HPV. But due to the gender gap in funding, the gender data gap, the gender innovation gap, we haven't really done much with this information. So what we've been learning since we've introduced the diagnostic tampon to market, we've now had over 11,000 patients, is that the convenience of enabling a person to use a familiar device instead of them having to go through an educational journey really lowers barriers to screening and importantly increases the rates of self-perceived competence in the patient, so they feel more comfortable with their ability to use the tool.
Next up is OsteoBoost, and we're going to hear from Laura.
Hi, everyone. Thanks for the opportunity to share with you what we're building. At OsteoBoost, we're working on one of the largest unsolved public health issues for us as an aging society, particularly women, that of osteopenia and osteoporosis. 60 million Americans have low bone density. Half of all women will fracture in their lifetime. And, in the last 60 years, we've made progress in so many areas, but the death rate from hip fracture has barely moved and the fracture rate has barely moved. And there's really been a lack of innovation to something that's super important to the quality of life as we age. In fact, more women die of hip fractures than breast cancer. So this is both a common and serious problem. And so we have built the cleared non-drug solution to treat low bone density. So OsteoBoost is an FDA cleared class 2 prescription device. We received a de novo clearance, which is pretty unusual for a startup. We were the 14th ever device cleared by the orthopedic division. We're the only prescription treatment specifically approved as an early intervention. So for osteopenia, where actually more than half of the fractures occur, and the only non-drug solution for bone health approved by the FDA. And at the heart of our solution is the precision medical device. But we know that to really have the ultimate impact on maintaining bone health and improving bone health, a comprehensive solution is needed. We have a digital app that helps patients with compliance, nutrition, activity. We recently acquired an osteoporosis specific exercise program, Wellin, that we've incorporated into our solution. So how do you prevent fractures? Stronger bones and don't fall. And we have data showing that our exercise program also reduces fall risk. We've launched in May and we've already seen tremendous success and demand for the product and very high compliance. Over 1,800 doctors have prescribed, including 30 of the leading academic medical centers. And we're excited to be able to bring the solution to patients.
Amazing. Thank you so much, Laura. I love that this is in the category. And sorry, I'm not sure why my video is not working, but love that we are again expanding beyond female exclusive conditions into areas that affect women differently and disproportionately. And to your point, this is just a huge issue for the health of women. Great. So my question for you is, with this really novel, exciting technology, you're one of the few that has also moved from R&D stage into, approval and commercialization. So we'd love to hear from you. What is the biggest lesson that you've learned having, gone through all of this, given that many of your peers in women's health are, very much kind of earlier stage in the R&D phase?
If the problem is important enough to patients, they will come. Someone said something about that earlier, build it, they will come. When I joined the company, I knew in my heart of hearts that if the device worked, that there would be tremendous demand. And that is proving to be the case. We've gotten to, millions of dollars of sales with essentially no spend on marketing. What I didn't know is what would be the acceptance by doctors of a novel solution from a startup. And it turns out that doctors really understand how bad fractures are. And they know that for a chronic condition, you need to intervene early. They know that patients, for unfortunate reasons, either can't use the medicines or not using the medicines or need something earlier. And so, I think, we're having to scale up faster than we expected and scale up our ability to work directly with the physicians. But that's an exciting lesson to be learning.
Great. Wonderful. Thank you.
All right. I love this one. It comes from NASA Technology, I think, at the beginning, right?
Yeah, NASA did the original research on using vibration for astronauts who lose a tremendous amount of bone in space, but those platforms didn't get good enough or consistent enough data. And so that our innovation was putting it directly on the hips and spine, which is the vulnerable anatomy.
Okay, over to our next amazing startup. Go ahead, Emily.
Hi, everybody. Emily Sylvester, founder and CEO of Mother of Fact, and just sharing my slide here quickly. And we're transforming maternal health by making reimbursable dietitian-led nutrition care a standard part of every pregnancy. So every mom, no matter where she lives or what she earns, gets the support she needs. And I'm a registered dietitian and a lactation consultant and mom of 4, one of whom is sleeping behind me currently. And I've seen how nutrition changes outcomes, but most women never get that care. Half of pregnancies involve nutrition issues, half. Yet fewer than 1% receive dietitian-led medical nutrition therapy, even though insurance covers it. And that gap drives costly complications and preventable inequities. And on top of that, clinics are short staffs and current tools miss those most at risk. And so Mother of Fact delivers telehealth, dietitian-led care built directly into OB, midwife, or family medicine workflows. This improves outcomes without adding staff. And we've launched with major health systems across the country, doubled patient engagement in nutrition and health and wellness related parameters, and deliver a 2 times return on our partners' investment in nutrition care. And our team unites clinical expertise, lived experience, and technology to close one of healthcare's biggest gaps, because healthier moms mean healthier families, and it all starts with nutrition.
Fantastic. Can you give us some insights in the nutrition piece and how do you communicate that and personalize that?
Yeah, really good question. And that's really important, because if it was easy to eat healthy or build it into disease and clinical management, we wouldn't have the chronic disease and the at-risk pregnancies we have now. And so we do it in 3 main ways. We're accessible. And so our patients use our app, but we're just an app on purpose so that patients get trusted dietitian care throughout the length of their treatment or pregnancy or family planning cycle. Our dietitians are obviously credentialed, gold star standard in healthcare, and they're also diverse, matching the patient populations that we meet. So a clinic in Utah who has a large Haitian Creole cultural population, we can get those dietitians to them. And thirdly, we meet parents where they're at. We're not saying go to Whole Foods and get kale. We're saying you have a 7-Eleven. Here's where you can go at the corner aisle and get some fiber.
And last quick question, how do you measure, what outcome do you measure? It can be the weight of the child or how the mother's doing 6 months or a year later. What's your sort of outcome measure?
Yeah, really good question. We have, again, several different levels of that. Digital health equity is a huge piece that we measure, because we have to make sure we're getting the information out there in a way that patients can comprehend and digest it. And 2, we're delivering it in ways that meet where the patients are at. So whether it's text messaging, whether it's our telehealth, which is where the money's at, that's a reimbursable, back claims that the clinics that we work with can get. And then we're getting to them when they need it in the grocery store, working with their WIC checks, in the mother-in-law's apartment when they're like, you shouldn't eat prunes because of this, and they're able to get access to our dietitians.
Fantastic. Food is medicine, let medicine be a food, and that certainly applies to the maternal fetal space. Thanks. All right, we're switching up to our best-in-class companies. These are often a bit farther along, and we're excited to hear from Pacify with Jennifer Sargent.
Great, thank you. I'm Jennifer Sargent. I'm CEO of Pacify. At Pacify, our vision is that all expectant and new parents will have a more equitable and positive birth experience. And we've created a solution with a couple of key tenets. So first, we want to deliver services that don't add fragmentation into the experience, but add value to the care that they're already getting through their providers, so OBGYN or advanced practitioner. So our solution focuses on a doula-led support. We match our members one-to-one with a doula that can provide both virtual and in-person care, and then make sure we can connect them to additional services like our IBCLC lactation network for needs that they have along the way. I think the second tenet that's important to us is we don't believe technology can replace the care delivered by a person. So as we've developed our technology platform, we've really done it in a way that we want to make sure it supports and gives more access to the person-driven care through our doulas and our lactation consultants. One great example of this is we have a 24/7 on-demand lactation line. So think of it like Uber for lactation. If at 1 o'clock in the morning, which is usually anyone that has been through breastfeeding, when you need the support, you can click a button and have a lactation consultant on your phone giving you the support when you need it. So really thinking about how we leverage technology to enhance the experience and really support our two key stakeholders, which is our members and our consultants, so our doulas and lactation consultants. How do we leverage technology to give a better member experience and to give a fantastic experience to the people that are servicing our members? I actually took the opportunity in the last year to become a doula myself and have been able to do some live births and work with members, and it's given me such an incredible vantage point of what the care our members need and how do we better support our clinicians, our doulas and lactation consultants to really do what they do best, which is provide great care.
Great, wonderful. Thank you so much. And congrats on all of the great work and your personal passion for this area as well. I love hearing when operators and founders, really kind of take on that provider role themselves to even understand their patients more. So I have a quick question and then I have a bigger question. So one is just, can you give us a sense of your scale, kind of as a member of the rising, or what is it, the established category? We'd love to hear a little bit more about kind of your reach here. How long have you been around? How many patients have you served across what geographies? And then we'll throw in a forward-looking question, which is if you could wave a magic wand and change anything in the space related to women's health innovation that would help you achieve your goals, what would it be?
Yeah, so Pacify has been around for over 10 years. We started in the infant feeding space and then added our doula solution a few years ago. So we have contracts with Medicaid MCOs, public health entities, commercial organizations across roughly 30-ish states where we're providing both virtual and in-person in some of those state services across our service line. So we typically see, 70 to 80,000-ish eligible members come through our solution on a yearly basis and driving meaningful engagement across that population. So growing our in-person, we have about 12 states that we're in-person while we provide virtual services nationally. And I think the magic wand question, maybe two answers, and a couple folks mentioned this. I think it's around fixing reimbursement and, really thinking about how do we reimburse meaningful services like doula coverage across all Medicaid and commercial lines of business, as well as lactation. It's not covered in Medicaid currently today as a required benefit. And then I think just how do we better connect some of these ecosystem partners, like the nutrition, there's so many great things that we're all doing that could impact the sort of journey in women's health. And so how do we better connect to each other and leverage the great services that everybody's providing?
Terrific. Home stretch, our last but not least best-in-class company is MedBridge, and we're here from Leah.
Yeah, hi everyone. My name is Leah Schleikov. I'm the Chief Client Partner at MedBridge. We're a digital health company, which is really transforming how care is delivered across musculoskeletal, women's health, senior care, and other specialty areas. But in women's health in particular, we're addressing one of the biggest challenges in healthcare today, which is access. We all know too often women will struggle to find timely care, to find specialized care, to have the time to get care at all. And we are really helping providers extend themselves and bring that care to women where it's convenient through digital means. we have a digital platform called MedBridge One Care. It's hybrid. It enables the hybrid care experience, but it really empowers clinicians to kind of reimagine how they're delivering care. We hear everyone wants to deliver hybrid care. The traditional brick and mortar system is really set up for in-person and traditional care, and that creates a massive access problem. And so MedBridge has provided the digital tool that can extend that care for a variety of conditions: prenatal, birth recovery and postpartum care, urinary incontinence, pelvic floor disorders, menopause stages, breast cancer recovery. A lot of these things will have a singular visit or a smaller course of care, and MedBridge tools enable that kind of care beyond the visit. And so patients can engage with our education, our exercises. We're able to collect patient-reported outcomes on them and functional movement measures if that's relevant for that particular pathway, and feed that information back to care provider teams to be able to direct care in either hybrid environments or remote environments. So these are really delivering care to the right level of care at the right place and the right time, and really helping quell that access concern. We know that the traditional brick and mortar model, works for some women, but it doesn't work for many women. And so how can we really enable those organizations to extend their care, allow the working mom to make weekly appointments, who can't make those weekly appointments, get those appointments or get the care they need in a more modernized and convenient way for them. We work with health systems across the nation. So we have, I think, over 3,200 healthcare organizations that use the MedBridge platform. And in women's health in particular, we have a study with a organization out of the Mid-Atlantic area where people in the urinary incontinence track had 75% of women indicated improvement in just a short amount of time, and really reduced their urinary incontinence scores from 9 to 3. So a 6-point improvement in those patient-reported outcomes measures. But what was really interesting is that we were able to also address that access issue, get people into care sooner, deliver those programs virtually or digitally, and enable more people to be seen in a convenient way.
Fantastic. Given that you're sort of, bridging provider and patient, I think your tagline has something about provider-centered solutions. What have you learned about integrating providers, clinicians of all sorts, in this digitally enabled world that would be illustrative?
Yeah, I think it's key. We can't cut the provider out, and there's a lot of point solutions or digital care solutions that either provide their own providers, which is disconnected from the traditional course of care, right? If a patient has a concern, they're going to call their provider that they know, whether that's in the health system or their advanced primary care organization, and they're going to listen to what those providers say. And so really equipping those providers with the digital tools to create that hybrid care environment versus remove those patients from the system and create that fragmentation and silos. So, we think that that's essential, and we think that our solution is unique because we do that so well.
Fantastic. Thanks, Leah. Thanks to all the amazing finalists who shared their solutions and companies today. You're all winners, but we'll be announcing the final winners at HLTH coming up in a couple of weeks. So hope to see you there, David. I'm sure you can share that slide. But we have we have about 5 minutes left, and I thought with Alice and I, we'd sort of tag team on any sort of broad, discussions or shared points between all these amazing finalists that would relate to both inspiring next generation startups as well as collaborators across women's health. Anyone want to jump in with some, thoughts or learned lessons in developing technologies and companies in women's health?
I think patients are driving change. We see it across so many of these areas.
Yeah, the idea of self-health. Everyone can now sign up and do a lot of these things virtually, and that seems to be very illustrative in women's health. We've seen some big players like get major funding, like MIDI and others. I think it's sort of opening up the space. We heard that the funding has not been as high in women's health. How have you guys approached funding and catalyzing the space, or what barriers have you found? Anybody?
Yeah, I think one of the barriers is just the regulatory environment and the reimbursement associated with things like digital care or doulas. I heard someone say doulas, right? There's a lot of regulation that kind of prevents some of these innovations to advance as fast as we'd like them to advance.
And I think you have to tie everything back not only to outcomes, everybody wants to save women and babies or prevent poor outcomes, but it has to be tied back to ROI. Similar to your question to me, Dan, how are you lowering costs? How are you reducing risk for the hospital systems or the payers? Reducing complications, but then, switches back to cost to the US healthcare system and then utilization. So the time of both patients and providers are being used in a more efficient manner.
Alice, you're funding in the space yourself personally, and with your fund, what questions would you have or insights have you seen across your portfolio?
Yeah, we touched on a lot of them, today in this discussion. And actually, we've gone 55 minutes without using the word AI. And that does, congratulations, everyone. And I'm actually really excited to think about how that is transforming women's health innovation from everything related to kind of internal processes to actual more products and services that incorporate that in its delivery. Yeah, so curious if folks have any thoughts to share there, especially for folks who started their journey kind of before this became a trend and became so integrated into all of our workflows.
Yeah, I can maybe jump in here. So we're certainly using and exploring AI more on the internal operational workflows and how we can become more efficient. I think the AI member facing is such an interesting question, and we get asked that a lot from some of our payer partners. And sometimes they're asking it because they want to make sure we're not using it in like sort of replacement of a person connection. And sometimes they're wanting us to use it. So I think how it relates to the like member experience and delivering care to me is a big question mark around how should we do that in a meaningful way? There's data security, questions that people are asking, and how do we do that in a way where it provides value for all of the people involved and doesn't sort of get too far into replacing that personal relationship?
The one thing I'll add to that, though, is I think that so much of what women's health has missed forever is true personalization, right? Like we really just treat everything as, oh, you have a problem with your ovary, we'll just take it out. Something's wrong with your uterus, we'll just take it out. Like we don't actually get to the root problem. And I mean, I always joke, Evie's been a machine learning company for 5 years, and now people like to rebrand us as an AI company. But at the end of the day, we're using data to stratify patients and predict the right treatments and ingredients for them. And I think fundamentally the tools that now exist enable us to do that on so much more of a precise level than we even could 5 years ago. And I think you see it every single day in the outcomes and how much better we're able to do when you're able to take into account so much more about a person. So I am personally very excited for the ways that we'll be able to improve outcomes even further using the new tools.
It's interesting. There's a bridge, I think, between what both of you just said, which is, what are we able to do with AI to bridge our understanding of what those personalized interventions should be and how they should come to fruition. The flip side of that, to Jennifer's point, right, is that particularly when we're working with vulnerable populations, with populations who have a degree of medical distrust, a technology is not going to replace the trusted human that needs to be providing their care, right? I think there's a big case to be made around the use of AI for personalization, and also a big case to be made for the use in AI as an efficiency tool for those humans.
Absolutely.
Right, but we can't do one at the expense of the other versus thinking of AI as a reinforcer.
Well, I think
Absolutely.
Um,
I completely agree with you, Maya. And I think a complete reimagination of how care is delivered, right? Like a completely new modality of care delivery, taking care to people's homes, is what I believe. And making that happen through a tool like AI is what is needed right now.
But I think healthcare is the perfect example of the best of AI and the limits of AI, right? So, there's all this data, physicians have been like Bayesian analysis machines, and suddenly we're allowing them to handle so much more data and make better diagnoses and plans. But then sometimes you need physical things, you need surgery, and it's like the ultimate Moravec's paradox that you're not going to That's the hardest thing for AI to do.
All right, we're top of the hour. Thanks to all of you for competing in the Digital Health Awards, for becoming finalists, for all the things that you're doing across digital health and women's health. I think it's a really exciting time to see this space evolve. Clearly, half the population plus are women, my daughter and wife included, and it's a great time to catalyze, leveraging these new tools from AI and beyond to make an impact. So we'll look forward to seeing the progress you guys make, the impact you make, and so we'll see many of you at HLTH at the Digital Health Hub Finalist Awards, and keep going with what you're doing. Thanks, everybody.